This medication helps relieve discomfort, pain, frequent urge to urinate, and cramps/spasms of the urinary tract caused by infection or a medical procedure. It contains methenamine, an antibacterial drug, and methylene blue, an antiseptic. These help prevent the growth of bacteria in the urine. It also contains salicylate, a pain reliever, and an ingredient to make the urine more acidic, which helps methenamine work better. It also contains hyoscyamine, an antispasmodic drug that relaxes the muscles of the urinary tract to relieve cramps/spasms. This medication should not be used to treat a urinary tract infection. If you have a bacterial infection, consult your doctor for more details. This medication is not recommended for children younger than 6 years old. When taking Uribel tabs 81.6 mg-0.12 mg-10.8 mg tablet urinary antispasmodics, it's important to follow your doctor's instructions. Typically, you'll need to take this medication 4 times a day with a full glass of water. It's recommended to wait at least 10 minutes before lying down after taking the medication, and if you experience stomach upset, you may take it with food. The dosage of Uribel is based on your medical condition, age, and response to treatment. It's important not to increase your dose or use this drug more often or for longer than prescribed. To get the best effect, it's important to take this medication at evenly spaced times each day. Additionally, it's important to avoid consuming large amounts of caffeine while taking this medication, as caffeine can increase the side effects of Uribel. If your condition does not improve in a few days or if you develop signs of a urinary tract infection, such as burning, painful, or frequent urination, be sure to contact your doctor. If you experience nausea, vomiting, dry mouth, dizziness, drowsiness, blurred vision, or constipation while taking Uribel tabs, let your doctor or pharmacist know. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. While many people using this medication do not experience serious side effects, it's essential to contact your doctor right away if you experience hot/dry/flushed skin, decreased sweating, eye pain, difficult urination, or signs of kidney problems. In rare cases, this medication may cause extremely high blood pressure, known as a hypertensive crisis, which could be fatal. If you experience severe headache, fast/slow/irregular/pounding heartbeat, chest pain, neck stiffness/soreness, severe nausea/vomiting, sweaty/clammy skin, widened pupils, vision changes, or sudden sensitivity to light, seek medical help immediately. While very serious allergic reactions to this drug are rare, seek medical help right away if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, contact your doctor or pharmacist. Remember, in the US, you can call the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch, and in Canada, you can call Health Canada at 1-866-234-2345. Before taking Uribel, make sure to inform your doctor or pharmacist about any allergies you may have, as well as your medical history. It's important to let them know if you have kidney or liver problems, urinary blockage issues, difficulties urinating, stomach or intestinal disorders, glaucoma, heart conditions, high blood pressure, myasthenia gravis, bleeding or clotting problems, certain enzyme deficiencies, aspirin-sensitive asthma, growths in the nose, a history of stroke, severe or frequent headaches, or a certain type of adrenal gland tumor. Uribel may cause dizziness, drowsiness, or blurred vision, so it's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. Additionally, alcohol, marijuana, tobacco, and alcohol consumption should be limited while taking Uribel to reduce the risk of stomach bleeding. It's also important to be cautious in hot weather, as Uribel may make you sweat less and increase the risk of heat stroke. Additionally, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products before having surgery. Children and older adults may be more sensitive to the side effects of Uribel, and pregnant or breastfeeding women should consult their doctor before using this medication. It's important to be aware of how Uribel tabs 81.6 mg, 0.12 mg, 10.8 mg tablet urinary antispasmodics may interact with other drugs. For example, it may interact with products like aproclonidine, atomoxetine, bupropion, carbamazepine, and more. It may also increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. Additionally, taking other MAO inhibitors with this medication may cause a serious, possibly fatal, drug interaction. It's important to avoid taking other MAO inhibitors during treatment with this medication, and most MAO inhibitors should not be taken for 2 weeks before and after treatment with this medication. Make sure to report the use of other drugs that may increase the risk of extremely high blood pressure when combined with this product, such as herbal products, nasal decongestants, and stimulants. And if you are also taking azole antifungal drugs, make sure to take this product at least 2 hours after the antifungal drug. Check all prescription and non-prescription medicine labels carefully, as many medications contain ingredients that may interact with Uribel. This medication may also interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much Uribel and is showing serious symptoms like passing out or having trouble breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include fever, fast or pounding heartbeat, severe dizziness, seizures, slowed or shallow breathing, and unusual excitement. Be sure to seek help right away if you or someone you know is experiencing these symptoms. It's important not to share Uribel tabs 81.6 mg-0.12 mg-10.8 mg tablet with others. This medication is specifically prescribed for your condition and should not be used by anyone else. Sharing medications can be dangerous and may cause harm to others. Always keep your medications in a safe place and out of reach of children or anyone else who should not be taking them. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When storing Uribel tabs 81.6 mg-0.12 mg-10.8 mg tablet urinary antispasmodics, make sure to keep them at room temperature and away from light and moisture. It's important to store them in a safe place, away from the reach of children and pets. When it comes to getting rid of the medication, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it has expired or is no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.